A new procedure making headlines. It promises to get rid of your fat without surgery. Sound good too good to be true? Well, our medical contributor, Dr. Marie Savard, joins us now with the details. Do tell, Marie, do tell.
Thank you, Robin. It's a new cutting-edge procedure that studies show can melt inches off your waist, hips, and thighs. As much as liposuction? Is it too good to be true? Here's what I found out. For many women trying to lose weight, the options can seem endless and at times futile, from extreme exercise to rigid diets. But there is one place even the most frustrated draw the line: surgery. Karen Kinnear has always liked her body, but like many women, she had that one problem area that just wouldn't go away.
I had the, as they call it, saddlebags, and I was not happy with how it looked.
Karen felt liposuction was too invasive, but then she heard about UltraShape, a device that claims to reduce the fat with ultrasound.
I was like, wow, that's something I would like to try.
It actually breaks down the fat cell and gets rid of the unwanted fat, much like liposuction does, except it does it non-invasively, meaning there's no cutting, there's no anesthesia, there's no downtime, there's no recovery.
It sounds too good to be true, but international studies show that UltraShape reduces fat thickness in common problem areas in just 3 sessions. Take a look before and after. The difference is not extreme, but it is noticeable.
The clinical trials, as well as our own experience, has demonstrated an average loss of 4 to 6 centimeters in circumference after a 3-treatment cycle. So that's about 2 to 3 inches after the 3 treatments, which is quite considerable.
Here's how it works. Patients spend a half hour under the UltraShape machine. The sound waves converge to hit the fat cells under the skin and make them vibrate at a very high speed, causing them to be destroyed. Experts say the fat is then carried to the liver, where it is removed from your body safely. But UltraShape isn't for everyone.
This is not a weight loss procedure. This is not for somebody who really needs to lose a lot of weight.
In addition, patients need to stay fit and eat right. UltraShape is in phase 3 clinical trials in the U.S., and doctors here say it could be approved in a few years.
Patients obviously want to look and feel better, but if they can do it non-surgically, that's going to have a real mass appeal.
Back to Karen. Here she is before UltraShape. And here, after 3 treatments, she lost an average of 1 inch on each thigh.
And my friends actually noticed, and I'm very happy with the results.
All right, so you have our attention, Marie. It's not approved yet here in the U.S., but around the world it is at this point. Is it safe? That's the first question everybody wants to know.
Yeah, actually over 50,000 patients have tried this, and we do understand what ultrasound does, and it's been extremely safe. First of all, there's no side effects. It gives a very focused ultrasound wave, so you don't burn or hurt the skin, which is what 4 older techniques have done. And it does seem to be safe. They've monitored liver function, looked for that, where does that extra fat go, looked for storage of fat, and didn't find any problems. But again, we need long-term.
There's no long-term studies at this point.
That's true. But on the other hand, there's no reason to be really worried that ultrasound, in the way it's delivered, would cause, in this case, any serious consequences, because you're just treating small areas of fat. That's the important thing.
So when could we expect it to be available here in the U.S., and how much will it cost?
Well, we're talking about maybe a few years. The researchers we talked to said it's in phase 3 trials, that in 2 or 3 years it might be available. Patients are already going to Canada now as we speak. And really the cost we don't know until it's established, but it's estimated anywhere, you need about 3 treatments to get the full effect, anywhere between $400 to $1,000, which is about half the price of liposuction, and obviously a lot less aggressive, a lot less invasive.
And this isn't for someone who needs to lose a lot of weight. This isn't about losing weight. It's just targeted areas, losing 1 inch or 2.
Absolutely. This is about aesthetics. This is not about your health. Really, diet and weight loss is critical, even with this program, because when you break up the fat cells, you need to be exercising to absorb and take up that fat. So it's really important. It's just for like the saddlebags, the love handles. You need to be in a healthy condition at the same time.
Muffin top, we're getting all the names to it.
Right, but it really does get up to 1 inch of fat in the areas that you just genetically can't get rid of on your own.
Can make a difference for some folks who are available.
It looks like it can, we'll see.
Yeah, we will see. Okay, thank you, Marie. And you can find out more about UltraShape on our website at abcnews.com. And we will see, because someone on our staff has volunteered to go to Canada and try this out, and we'll monitor her results.